Since October's meeting in the House of Commons, the number one thing I'm being asked is whether I think that non-veterinarians are going to be banned from performing pregnancy scans with ultrasound. I don't think this is going to happen. This was certainly not suggested by anybody, either on the panel or even in the audience at that meeting. To do so would put so much pressure on vet practices to fill in that gap and perform that service. It's a service that most vet practices don't want to do, or certainly don't want to do in the way that lay scanners are doing it, taking a lot of time, showing the owner the images, saving lots of images and videos to send to their clients. That's not what vets want to do. They want to be treating sick animals. Vets also don't have the time to do the training to learn pregnancy scanning inside out. Yes, with minimal training they probably can confirm a pregnancy, but can they perform gestational age calculations, give approximate litter sizes, as well as somebody who's dedicated years and years of their life to doing that one specific thing? No, probably not, and they don't want to. We have vets who do. We have vets as members of the Animal Ultrasound Association. I've trained many vets on our courses before, so has Yvette. I remember some of the first courses that we ever ran together, we'd have equal numbers of vets and breeders together on the course. So there is recognition by vets that this is a real skill that needs to be learnt. So I think when it comes to the crunch and people sit down and really think about this, the idea of stopping this UK-wide network of highly skilled, highly experienced, very well equipped lay scanners from performing something they have become expert at would be a very bad move. So why this very negative view that's being reported by Nature Watch of vets of the lay scanning profession? Well, I think we all know the answer. Over the last few years, the quality of people out there scanning has dropped massively. And that directly correlates with the explosion in more and more individuals and companies offering scan training with no qualifications and often very little experience. If this survey had been performed 10 years ago, I suspect that the results would have been the complete opposite, a very positive response from vets about lay scanners. Certainly there is in other areas of veterinary medicine. Cattle scanning, for example, where the training is very strictly regulated, is very well accepted by vets, and vets and lay scanners work hand in hand in a very complementary way. That used to be the case in the UK with canine and feline pregnancy scanning. There didn't used to be this rift. It's my opinion, and I said this at the meeting, that before we even look at regulating and controlling the people who are doing the scanning, we need to first look at regulating those who are teaching it. Let's cut off the source. If we can all agree that the quality of the people being churned out right now with very cheap Chinese scanners, with very poor training, is not good enough, then that's what we need to control. And it's not those people's fault. It's very difficult for people to distinguish a good training course from a bad one. If you're not already in the industry, how do you even know what a sonographer is or why it is that you should be taught by one? One of the missions of the Animal Ultrasound Association is to spread this word, but we're fighting an uphill battle until those who have the power to act join us and do something about the quality of training in the UK. If we solve this problem, we go a long way to solving all of the problems and restoring the reputation of lay scanners in the United Kingdom. Good lay scanners and veterinarians are working together for the same goals. Let's cooperate more, and let's do everything we can to spread the right message. Another point I made at this meeting is that our paraprofessional lay scanners are the eyes and ears on the ground, doing the work, reporting these things. They are the good guys. They are on the same side as the vets, the same side as the animal welfare activists. Let's keep that momentum going, and I don't think there's anything for lay scanners to be worried about.